Hi, I'm Daniel Nyman. On behalf of the Forum for Healthcare Strategists, as well as our colleagues at Wolters Kluwer, welcome and thank you for joining us for Digital Touchpoints That Work, enhancing communication and visibility with providers. Staying top of mind with busy physicians takes more than a handshake. Today's most effective outreach programs blend digital tools with field efforts to create timely, relevant touchpoints that keep providers engaged and connected. In today's webinar, we'll explore real-world strategies for elevating your message, fueling service line growth, and strengthening physician engagement in measurable, meaningful ways. Before we begin, if you'd like to ask a question, please enter it into the question and answer pane located on the bottom of your screen at any time. Our panelists will respond to as many questions as they can in the time that we have. With that, I'll turn the program over to our moderator, Susan Boydell, Principal Barlow McCarthy, who will be moderating today's discussion. Susan?
Thank you, Daniel. Welcome, everyone. Thank you so much for joining us today. I think we've got a good mix of marketing, communications, physician relations, all on the line, which kind of just says a little bit about how important this topic is. Again, I'm Susan Boydell from Barlow McCarthy, and we spend our days in the referral development bucket. But one thing we know for sure, that referrals are kind of the lifeblood of growth. But here's the challenge. Physicians are flooded with messages. People want their time. People want to have a conversation with them, and that is harder than it ever was before. So with that, it brings us to what other strategies do we have in place to make a connection and show an impact when we need feedback, we need input from our physicians. So the goal for today is pretty simple. We're not talking about the field staff today. We're actually talking about everything else that needs to be done to connect with physicians. We're in the digital space, everything that complements and amplifies what they're doing right now. So like Daniel said, if you've got questions, use that Q&A box down there. That way we'll keep a track of that. We'll leave some time at the end for it as well. But also, we'd love to have some interaction. So use the chat box. If you've got ideas you want to share, I'll be watching it. So if you stick a question in there, I'll try and catch it. But use the chat box as well, because I think we can all learn from each other. I'm going to kick things off, and mostly by taking just a quick look at what the physician landscape looks like today. I'm going to guess most of you are probably, when we do this, you'll be going, yep, that's what I see, that's what I hear. And you might have some ideas where you say, well, here's what's really bad in my market, or here's what I hear from my physicians. So stick that in the chat because I think it'll be helpful. Then I'm going to turn it over to my great colleagues that we've got on the line today. We've got Kevin Wyne, who's from HonorHealth. And he is leading the digital strategies at HonorHealth. And joining him is Veronica Campbell. She oversees physician relations and referral growth strategies. So the two of them together have basically worked together to figure out how do we make this, how do we hit all the physicians we need to, with the message that we need to, that not only elevates from a growth perspective, but elevates the brand. And then in addition to that, we also have Ben Crowe from Wolters Kluwer, and he is a content expert. So I think you're going to learn a lot today from him just on what resonates with doctors. What do they need to see? How do they want to get it? So I think between both of them, I think you're going to get a good understanding, a good idea of things you can implement. So let's dig in. So everybody probably is going to get this piece right here, okay? Everybody wants to talk to doctors, like I said, but there's very few of them that really want to listen. I'm going to guess there might be some of you even on the phone that maybe even done some research, have talked to your doctors, and I bet you hear a lot from, you send me too much stuff. Or here's the other thing we've realized in our world, they don't like to read anything. It's not that they won't read it, that they can't read it, they just don't have the time to read it. And if it's not relevant, they really won't read it. So that's where Ben's really going to come in this piece too, as well as Kevin and Veronica. So think about this. Their priorities are patient care. When we think about what's the most important thing to a physician, 9 times out of 10, it's take good care of my patient. So when you think of that, what's in it for them is what comes to mind. So let's move to This, we could probably add a longer list to even this whole piece, but this kind of gives you our world that we sit in. And it's like, so what the health system wants. The word physician engagement has been around for 20 years. We're still talking about how do I better engage physicians, and not only where the organization's going, into the decisions that we make, the strategies that we make, how patient care is delivered, all of that, physician brains are needed on it. When you think of the marketing piece, just like I said with Kevin and with Veronica, they want visibility. They want to have brand preference. So when you think of, I need to send somebody, my patient needs blank, you think of, in their case, HonorHealth. And now we all know what the physician relations piece is, more referrals. And then the last one is this vendor piece. They've got something that can actually help our physicians from that perspective. But here's where I'm going to flip you a little bit. What's in it for the physician? So let's talk about docs for a second. And most of you, especially in those physician relations folks, this is your world right here. Most doctors are crabby right now. They're overwhelmed, overworked. I mean, I will tell you this. I read a lot about burnout, and I will tell you it's positive in that it's moving in a better direction than where it was from like a COVID perspective. But we still have a long way to go. A lot of times physicians will say, well, these are the most important things I need, let's say a health system to help provide for me. Yet it's sometimes the thing that they get the least amount of. So this overwork and underappreciated, it just sits in our space. And all of us have a chance to hear it and listen to it. And then they just have limited time. So when I want to think of doctors and from a communication perspective, and I want to have a relationship with them, I want us to flip our thinking from outside in to inside out, okay? Or actually the other way around, I just said it backwards. Inside out thinking is where we oftentimes sit. So everybody I just put you on that top of that slide, we're all thinking about, okay, here's what we've got. We need to tell them about, we've got this. All of that. Flip that to, what do they need? What's important to them? What would make them want to engage with us more? What's the content they want that would matter to them? And how do they want that delivered? All of what you're going to hear today. So what's in it for them? Everyone knows with them. That's the key piece of this. So this is just a slight piece of looking at. There's the traditional physician relations piece. Like I told you, this is our space. We sit in this all the time. It's all about one-on-one relationship building to understand what their patients need and when, and making sure that they think of, in this case, HonorHealth when they do that, okay? It is highly targeted and highly data-driven because it's not a cheap endeavor. These are liaisons, these are specialists that are out in the field having those conversations. So they're highly targeted. What about all of those that don't fit in that target list for our liaisons to be able to have conversations with? That's this piece. When you think of nurturing, when you think of, can I soften the market? Or this is one that I think so many times in organizations, it's when we're thinking about doing new and different things or changing processes or bringing new service lines in, all of that, how much time do we spend in understanding from the referring physician what matters to them, what matters to their patient, all of that. It sits in all of this. So today we're going to talk about what are those scalable digital touch points. Scalable is a good word in there. The consistency and the content that physicians value. And then how do you blend that field team with the digital piece? And how do the two work together? And that's a piece that HonorHealth is going to bring to us. So with that, I'm going to turn it over, Veronica, to you, and I'm going to let you take it on.
Great. Thank you, Susan. Good morning, good afternoon, wherever you sit in the U.S. It is a nice sunny 100 degrees here in Arizona. Little background about HonorHealth. We're a very comprehensive community-based health system that serves the Valley of Phoenix, Arizona. We operate 9 acute hospitals, a couple of specialty hospitals, and a behavioral health facility. Plus, we have some joint venture surgery centers, along with some urgent cares and freestanding emergency rooms. So beyond acute care, we also have a very robust medical group with over 30 primary care clinics and growing, 33 urgent care clinics, and then 86 specialty care clinics. And on top of that, we also have our own accountable care organization. So to give you a perspective of kind of our size and scope, this scale is fantastic with opportunities, but it also presents itself with a lot of challenges for physician engagement and communication.
Thanks, Veronica. And my name is Kevin Wyne. I'm a manager on the digital marketing side. I oversee the service line liaisons, as well as physician and APP communication and some of our digital reputation efforts. To give a little bit more background, the marketing communications department took over physician and APP comms earlier this year, and we've been working together to develop our 5-year strategy. So the strategy is going to include traditional and digital channels, and we're going to communicate with a mixture of internal and external providers, sharing messages that drive engagement with our health system. So how do we measure this? Through referrals, hospital utilization, and recruitment. And we're using a lot of the same tactics that have worked with our patient communications efforts. So the initial successes have primarily been qualitative, but I'll say that our communications are definitely more professional, on brand, and most importantly, measurable, so we can figure out what's working and what's not. Most of our progress has been on the internal communications front, I will say, and we've been experimenting with different ways of sharing our message with outside of the physician enterprise, which we'll get into shortly.
We love to experiment. And this was our first experiment. So you're going to see progression in our case studies because we didn't know what we didn't know, right? So we needed to understand what we didn't know. So we devised a referring physician advisory council. We developed a charter, we got some executive sponsors, and we basically invited community providers that don't necessarily work within our network. We had a combination of both in-network and out-of-network providers that became part of this council, along with a variety of specialties, but we were really trying to focus on the primary care. And our purpose was twofold. Like I said, we didn't know what we didn't know, so we needed to ask. And where I sit for market development, obviously I want to grow business, I want more referrals, so I needed to understand what did that look like? What were the barriers that they were encountering and how can we fix them? What made them tick? What made them decide on who to send their patients to and why? And lastly, how do they want to be communicated with when we have new services, new programs, new physicians coming into the market? We needed to know how to best reach them. So we devised this Referring Physician Advisory Council. It's very loosely meeting cadence because we wanted to make it very flexible. So we've had 2 meetings so far within 3 months apart, and we gained a lot of insight as to what their challenges are. We were able to identify opportunities for improvement from an operational standpoint. What could we do to enhance patient experience? Because like as Susan said, what's in it for them? They want their patients to have the best experience possible and have great quality care. And understand what makes them make that conscious decision to send their patients elsewhere.
So doctors are inundated with messages on an hourly basis. We've discussed this already. It's a known fact. So one of the biggest things that we did when we consolidated physician and APP comms at HonorHealth is figuring out where and when all of these messages were coming out. So we know that med staff services, we know that our IT department, we know that the foundation, so all of these different areas of the business are sending messages to doctors on an hourly basis. So figuring out how our sales and marketing teams can rise above, cut through the noise, and even deliver simple organizational updates is obviously the biggest challenge. So the advisory council gave us a platform to open the dialogue about this. And as it turns out, shocker, what convenient and helpful communication looks like is different to everybody. As much as we'd like to deliver a message to each doctor with a flyer and a cup of coffee, we just can't do that. So fortunately, most of the committee agreed that text messages actually were the ideal for one-off communications. Which is great because for us marketers out there, we know that, and really for everyone, we know that text has the best success rate. It's pretty hard to ignore. And another thing to point out that even down to the content type, it really just varies around what each doctor would like to see. and what they tell us they want to see, and then what they actually click on. So being able to measure your work is how you're going to determine what you need to scale and what you need to pull back on. So something like we want to know more about ways to optimize our Epic. We want to know more about wellness and walks and meetups with other colleagues. And then when those articles don't get clicked on, and then people click on, I want to vote for myself or my colleague on TopDoc. I want to learn more about the next awesome social that Veronica and team are going to be hosting. That's how we can figure out what types of things that we promote in, say, our MedStaff newsletter, and what types of things we draw back on so that we have the most engagement.
I think the key takeaway, Kevin, was kind of what you said. We can't customize it. Everyone has different preferences, but it's great to be able to know those nuances, to be able to really direct those messages to those that where it counts, right? And so they feel like you listen to them, and you're delivering the message and the communication and the information that they want to hear in the manner that they want to hear it. So I think an important takeaway is you have to be very flexible, and you have to be agile, and you have to, and it's okay that one method works for one group of physicians and a different method works for others. That's okay. It's not a one size fits all. And I think that was our biggest takeaway from this council. Another takeaway is when we asked how they wanted to how do they want to learn about new providers coming into the market, they all said they wanted to meet them personally. So that reinforced what we're doing out in the field with our peer-to-peer meetups that we do with our physicians, and so that help us really help us identify that is a method of communication that really resonates with them, and it really works. And I always say, can they pass the sister or the mom test, right? Because we all know that patients always ask their doctors, well, where would you send your mom? Where would you send your sister? Doctors need to know who they're sending their patients to on a personal level. So those personal touch points are so important to continue doing.
Yeah. And tracking really those preferences in the CRM. So we use a Salesforce instance of our doctor CRM at HonorHealth, and we track all of those preferences in there. So for doctors that tell us they want to be texted to, we can select that. And it is important to note that texting would likely require an opt-in. So for those of you that are considering sending out a text message to all of your doctors, it is important that you get that opt-in, just because of the personal nature of sending a text message.
Thanks. Okay, second case study is our physician social, and it's really more than it. I mean, they're a good time. Socials are great. We have a lot of fun. We actually have our annual social coming up this Friday. We have over 600 RSVPs, which is our biggest RSVP to date in my time at HonorHealth, which will be 8 years in December. So they've really gained a lot of momentum, and it's not so much just because it's a party, but it's a fantastic opportunity to get in front of their colleagues and referring providers, especially if they're a specialist. And then for our primary care docs that attend, it really gives them the opportunity to meet those that they haven't seen in a while or that may be new, again, to build those strong relationships and form alignments and pass that mom test. But it just builds a better sense of community within our network. A lot of our competitors don't do these, and so we feel very fortunate to be able to, just have an opportunity, a night out. The agenda is, there is no agenda. We're not pushing any information down them. It's really an opportunity for them to meet one another and collaborate and build stronger relationships. The second reason why we do this is we do our annual physician engagement surveys. And so we time these right before those surveys go out because it's part of our balanced scorecard. So we want to make sure, as part of our physician engagement and well-being strategies, that they attend and have an opportunity just to break away from the rat race of seeing 50 patients a day and have a time that they can just let their hair down.
And they are great parties, and this one is, I'm sure, going to knock it out of the park. So organizing in the CRM as well as promoting a lot of the events does fall to my team. So one way that we do that is we organize it as using the campaign functionality in Salesforce, ensuring that all the right statuses, all the right communication preferences, so that those physicians that we want to ensure attend, we are able to communicate that with them and then track whether they opened our emails, whether they opened our text messages, whether they opened it and didn't RSVP. So really getting down to the nitty-gritty and really tracking your efforts is going to be the key to success. Some of the new areas that we've accelerated and I feel like have made an impact on this particular social, as Veronica mentioned, we've had more registrations than we have in previous years. So we are we're bringing forward all of the digital areas that we can. So there are a lot of bulletin boards across our campuses, across our clinics that we are pulling back, and we're introducing screens. So these are screens that our marketing colleagues are able to upload information to from a centralized playlist, right? So they're working from home, they're working from a corporate office. The field sales teams don't have the ability to walk around to each campus and hang up a flyer and then pull one down every time that there is a new event or a new program that they need to update. So using a platform, we're able to upload a visual talking about our next great social event, and with a QR code on there where somebody can walk by and either use a friendly URL or a QR code to scan to RSVP. So how do we know whether these things are working? As digital marketers, we look at the QR code and we can upload different instances of them. And then we can see where someone registered from. So if somebody registered from a flyer that was given by a member of Veronica's team, that individual should get credit for their efforts. If someone is able to register from a screen that they saw in one of their physician lounges, if someone registers from an email, we want to accelerate the things that are working, and tracking them is the start.
Okay, our last case study, the East Valley. The East Valley of Phoenix was a market that HonorHealth was not in. And in September of last year, we acquired 3 new hospitals through a bankruptcy that happened in our market. And again, we had never been in this market before. Most physicians knew who HonorHealth was because a lot of physicians do live in the Scottsdale, Phoenix market, but the community certainly did not know who HonorHealth was. So we needed to figure out, how do we take these underperforming hospitals and introduce HonorHealth's reputation and quality to the market. We did that, number one, by conducting listening tours. This is where my team and I had sit down one-on-one meetings with the primary care clinics in this market to better understand what they needed from a new health system entering the market. They understood what was there before, and unfortunately, they went bankrupt. So now HonorHealth was taken over, but we didn't want to just take over just to take over. We wanted to take over to make an impact to the community. So we needed to listen what they had to say. So our team did not go in to sell these 3 new hospitals or sell any programs or sell any of our clinics that we acquired. We really went in there to listen deeply about their concerns, what is needed in the community, what HonorHealth could do differently. And we took that back, all of that information that we received, and we bubbled it up to our senior leaders. And we wanted to make sure that the community physicians didn't think that this was a one and done deal. We didn't just come in and listen to what they had to say and then disappear. So along with my partner in crime, Kevin, we created a way to engage these physicians after the listening tours to give them very important updates about what we were doing to change these campuses from a quality and staffing perspective, as well as equipment perspective. Just clinically, what were we doing to overhaul these hospitals that was going to resonate with them for what they told us was needed in the community? So Kevin, do you want to talk about those email campaigns a little bit?
Yeah, of course. So Veronica and I worked with the campus leaders and really service line leaders across the entire East Valley to bring forth those stories and those innovations and improvements that we are making, so that we can deliver them in a timely, appropriate manner. And of course, I've reiterated this so far, but really just doing what's trackable, right? So we want to share the message, and we also want to see what everyone's interested in. So really looking at what are the click-through rates on certain areas, and then it allows Veronica and her team to then deliver more information about a topic that somebody might have been interested in. So we sent out a few emails already. They were what the doctors were asking for, so we're delivering on that message. And then I would say in the East Valley, where our relationships aren't as strong, is where we've been experimenting with external physician marketing on some digital channels. So on the right, you'll see some of our new, these are our paid search and paid social advertising. So some things that we did in addition to the listening tour, we're conducting some consumer research and finding out what doctors care about most. So as it turns out, they care about quality outcomes, they care about solid work-life balance, and they care about fair pay. Doctors, they're just like us. So in our advertising, we're reiterating that message, and it's the same message that Veronica and her team are delivering out in the field.
And I think this is like the best case study that we have to be able to show how physician relations and marketing really came together to approach this. Us as field sales teams, actually sitting down with doctors and really engaging in crucial conversations, taking that information back, letting our marketing, our digital experts create content and mechanisms and channels to be able to communicate back to those physicians instead of while we continue to have additional listening tours in the community. So I think it really worked out. It's been working out really well. I think another success of this is we heard overwhelming, and we interviewed probably 170 physicians during these listening tours over the course of a year. And in one particular hospital that we have, they overwhelmingly told us we needed to change the name because of the fact that it had a bad connotation in the community from the previous owners. And initially, our senior leaders did not want to change the name. They didn't want to disrupt what was happening in the community. But when we brought back that information, guess what? We're changing the name, and we're actually unveiling the new name on October 1st. And we're inviting all of those physicians that gave us input to a sneak peek the night before it goes public to learn about the new name based on their feedback. So we're engaging with them, and we're saying, we heard you, we listened, now we're taking action.
Veronica, I just wanted to jump in for both because I love this. Because when you were first starting to talk about the case study and how you did the listening tour, always the biggest thing is many times we get asked by our leaders, go out and ask, go find out what they need, all of that sort of thing. And we bring it back to our internal audiences, and then we don't really know what happens with it. So this is a fabulous story of like how you connect all the dots. Like it's a full circle. I went out and I asked, I brought it back to my leaders. Here's the things we're going to do. We're going to now take that back out to the community so they see it. And it probably works the same on the consumer side, but definitely on the physician side. They want to know their voice was heard. And think what that does from a relationship perspective. So I love that you shared this. It's really good.
Thank you. We feel like it's really building the credibility in the community of a market that we're just, tapping into. And I think Kevin and I are really proud of this work because it really shows what teamwork can do, and really marrying the physician relations with marketing, it works.
Yeah, it's great. It's really great.
Sorry, one more point I just wanted to make on that last slide, and I think I feel for the folks that are out there saying, Veronica and her team met with 170 doctors, and there's only so many hours in the day. So there are ways, of course, to extend your reach and get in front of doctors that may not be in your network, or you haven't been able to get past the gatekeeper. And we are experimenting with some of those. I don't claim that we've figured it out, but I did just want to share some quick insights of some things that we've tried. So we have used IP, IP and NPI matching so that we can meet doctors on the websites that they're already visiting and advertise to them with messages such as you'll see on the right, and then refer with confidence really being that call to action. So when somebody were to click a contact us form there, that would bring up a page where they could then schedule a meeting with a member of Veronica's team. So again, using Salesforce, a new lead comes in. This is a doctor that wants to learn more about how we bring our A game or how they can count on us. And then it allows really us to expand our reach beyond our network. We've done other things like purchasing email lists. We've tried sending them on our own. We've worked with vendors where they send the communications on our behalf. Again, still early days. Finding so far, again, no silver bullet. One other insight I wanted to share, just something that we've tried, which is the LinkedIn advertising approach. So it is a unique channel because there is such an ease of matching profession. So the user is telling us what their job is so that you can match your advertisement to them and market specifically to doctors.
It's great.
Kevin, I'll let you take this one.
Sure thing. All right. So from the case studies that we've talked about, our biggest takeaways really are just listening first, then acting, do your research, figure out what your market wants, and then you can develop the core message. Relationships, where they amplify everything. So the relationships that you do have, learning from them, and then expanding upon those learnings that you're getting from your existing network and using them to reach new audiences, and then integrating, collaborating. I love working with Veronica, your marketing and your physician relations colleagues. There's just different things that everyone brings to the table, and you're going to be so much more successful together. And when you pilot things, the highs and the lows you get to experience together. And I think we're gonna segue here in a second. And if you click twice for me, Susan, I think there's some words will come on the screen. Awesome. So, oh, sorry. If you could just go back.
Wait. Sorry. I was a little fast with the fingers.
All good. All good. So really, what is the challenge of self-advocacy? We can say that we're great until the cows come home, but independent validation matters. So how do we work with others that can validate the message that we're saying? We think HonorHealth is great. Who else agrees? And that's where I'm going to segue and pass the mic over to my colleague, Ben.
Okay. Hey, thank you, Kevin. And hello, everybody. We can go one slide ahead, Susan. My name is Ben Crowe. I'm with Wolters Kluwer. That might be a name that you are very familiar with or unfamiliar with, depending on your role in healthcare. So anybody that is a physician, a healthcare provider, a nurse, an advanced practice nurse would be working with many of our tools and products over the course of their career and at many kind of touch points throughout their day. I realize people in healthcare administration, marketing, and other roles may not be as familiar with us, but if you do survey physicians, they'd probably tell you about the journals that they work with or that they read or the societies that they're members of. So all that falls under the Wolters Kluwer umbrella. So what I do, my role, I'm a director of audience solutions. And audience solutions is really how we as a publisher, we're a publisher, can match our audience, whomever they are, whatever demographic specialty that they're in, how we can match our audience to somebody that would like to market to that audience. So my team works with big pharma, for mature drugs and drug launches and how to market those new products to physicians and tell physicians about those and really with the interest of improving health outcomes and patient care. So my team does that. My team does some work with marketing for medical device companies, CME, medical education, recruitment, and of course our this audience, a segment which is really important to us on the hospital side and anything to do with referral, reputation, retention, and recruitment. So my team works on that. And what my team does, they're sort of audience experts where they help match an audience and sort of think through an idea to get a concept out into the market. One of my colleagues is actually on the call now, Ryan McGee. So you might be familiar with Ryan. So Ryan would be one of the folks that would activate all this. But at Wolters Kluwer, we do a lot of different products and programs. You might be familiar with Ovid, which is a database that physicians use to access content, their journal content. We're over 400 journals are published by Wolters Kluwer under the Lippincott brand. And we have several proprietary brands, our own journals. And many medical societies outsource much of their publishing model to a company like Wolters Kluwer. And so we have, I think, 70 societies that publish, several journals for us. And there's some of them I call out here. ASCO, which is the American Society for Clinical Oncology, AAOS in orthopedics, the American Academy of Neurology, the Journal of the American Association of Physician Associates, AANP for nurse practitioners. So we cover a really wide swath And so we have access to a lot of data and understand what physicians' habits are and routines are when they consume content. And if you advance the slide, Susan, one thing I had to call out, and I am sorry I sent a new slide in today, but we were just awarded yesterday one of the most trustworthy companies in the world by Newsweek. I think we're in the top 20 out of 500. And you'll see later on why that's important, and that's critically important for us as an information provider and a data provider, that we're trusted at every stage in the industry. So you'll see that in a second. But on the medical society front, people are members of their society, typically their entire career span, from medical school all the way through. And we say, with a lot of confidence that a lot of the societies, 90-95% of those specialists are members of the societies. What is the number one thing that somebody does with their society? They interact with their journal. They submit articles to their journal. They'll read the clinical updates and the guidelines. They'll read the research. Okay, so if we continue on to the next slide, you're going to hear a little bit more about this. So the publisher's perspective that I'm offering for all of our colleagues from healthcare systems is, how do physicians, NPs, PAs, and then healthcare providers, HCPs, how do they access this content that's critical? Okay, how do they manage in this current era of information overflow? So much going on. So what's important? What do I read? I have limited time. I have to do the patient care and deliver outcomes, but I have to be an expert in my field. So that's what we do. How do those physicians and healthcare providers access and interact with this critical content? What are the means, the medium? Okay, how deeply do they go? What kinds of articles hold attention? And why I thought all this was interesting, and the conversations I've had over the last couple of weeks with Kevin and Veronica and Susan has been, maybe there's something that we can offer from our insights that can improve your engagement with your physicians that you've already got that might already be working with you, or the ones that you want to refer into your systems, or the ones that you want to work for you, or the ones that you want to retain or recruit. And then if you are affiliating with the right kind of content, the right message, can that help you drive those goals, the referrals, reputation, and recruitment goals? So slide. Okay, so the core of the information I'm going to share up until about 12:20 or so is from our annual content consumption survey. So we have been doing for many, many years a content consumption survey of physicians, nurse practitioners, and physician associates, how they interact and consume content. This is not from our own database of readers. We sourced, we wanted to start with a survey of the universe and then have enough input from every specialty to have strongly, statistically valid results from each. So that's the survey that I'm going to tell you a little bit about. We also do surveys and get data from the company formerly known as Kantar M3MI that does a lot of sources and interaction. So we get a lot of directional information. And what that helps our team in Audience Solutions do is continually, re-platform products and add products and how the journals are delivering content. So the next slide. Okay, so I'm going to dive into the resources that physicians use to keep up to date within their specialty. You're probably going to want to look at a lot of these slides in more detail later because there's a lot of granular information. Some of the slides, I'll let you know, I'm going to break it out between physicians and any specialty or the NP and PA audience. And the reason that we're doing that is they mean different things to different healthcare systems. We know that a PA or NP now provides about more than 50% of patient visits in the country. So they're incredibly important to that community. And then at some points, I'm going to say what the change year over year has been in content consumption. And the reason why I'm going to show you the year-over-year changes is just because we don't know the future, but we know the trend lines of the past. So if you look on the left, the dark blue are physicians. Which of the following resources do you use to keep yourself up to date on the latest research? Okay, CME, very, very important, 75%. Okay, conferences and symposia, the personal interaction. Okay, and then we have the next 5 or 6 items are all things that we would produce as a publisher. So online journals, journals in print, webinars, society websites, those are usually driven and fueled by journal content. So those are all critically important. And then further down, physicians, of course, watch videos, but that might be for training, so they're not as important. Social media is much further down the list. That's also important, has a role, but it's not a resource to keep up to date on the latest research, okay? And that is directly connected to outcomes. So the next slide. Okay, so what you see here on the right, the only difference is the number of years in the profession on the upper right. So this is the kind of thing, if people are interested and you might want to say, oh, Ben or Ryan McGee, we're kind of interested to know a little bit more granular detail, feel free to reach out. The journal online on the left, 79% physicians, more than 10 years in the profession. Physicians 10 plus years in the position, in the profession is lower. So we've got younger physicians accessing journal content online at a higher rate than the folks that have been around a little bit longer. Not surprising. So does that mean anything to your messaging? You might want to be going after residents. You might want to be going after people that are going to be making their first career move. Where do you want to put a message? Podcasts are very popular with the newer in the profession, and in email newsletters, you might get a better reaction and response from somebody that's been in the profession a little bit longer. Okay. The other thing we might be able to draw out is where the KOLs live, the key opinion leaders. So we could do like a slice on the data and show where the KOLs are, and they might be in, a little bit in the email newsletters. And email works very, very well if it's coming from like a trusted content provider. So everybody sends email out, but what we do is we really control the number of emails that are going out by Wolters Kluwer, branded by Wolters Kluwer, and that has content that people are going to open and click on. So yeah, we can see email open rates in the 20 to 25% range, and it's all very predictive for us. So next slide, Susan. Okay, so then we know how people go about accessing digital content. This is what's out there. What do I need to read? What do I need to do to keep on top of my profession? So the websites from the society and the online journal, 76% for physicians, and just a little bit further behind for the NPs and PAs. So that's where they start their survey and sort of understanding of content that they're going to relate to their practice. Then there might be an academic search engine, and that's something that we provide under the Ovid platform, if folks are familiar with that. And then further down, open source kinds of items. Next slide. And I'm going through this quickly because I'm going to get to some key takeaways by 12:20. Okay, so no surprise then that over the last couple of years, digital journals are the most, they're the journal of record, which means they're no different than the print. It still carries the PubMed identifiers, their access to content. You can get the full content and you can get the full archive of the content. And then if we're marketing something, we can tell a subset of neurologists about myasthenia gravis, and we can know through, I saw a question come up about NPI numbers. We can know through some NPI tracking, who is maybe being targeted to provide that type of care and treatment. So then we could provide an article in an email that links out to a website about this, the subspecialty, and then really drive up the engagement that way. So I'm going to overuse the term engagement, but that's always what we're looking for. So we try to set the items aside that aren't driving the engagement and really keep focus on the engaging items. So next slide. Okay. So what are the types of content? The type of content that are most influential on treatment decisions and outcomes. So I heard Kevin and Veronica, from their survey, top 3 things. I think the third thing I heard was outcomes, patient outcomes. That's what we're here to do collectively. And what's the kind of content? So there's a lot of different kinds of content. Peer-reviewed content, 81% for physicians. That's the kind of content where a physician has completed a research study, and it could be in the context of a community hospital, submits that for peer review to their journal. Their colleagues, give that article credibility, and it gets published online and in print. So that's critically important. Then we've got like review articles, which is a review of the literature, and then further down, I want to just call out guidelines and standards because that's going to come up in a minute as well. So guideline and standard, they're always changing. They are usually provided by the context of the peer review of the society. Okay, so next question. Oh, impact the society affiliation. Wolters Kluwer publishes journals on behalf of societies. Many publishers do. The influence of a society affiliation on a journal. On the left, 63%. It is more influential. Okay. There's another question about impact factor, which comes up in some cases. And then, are you more likely to visit a website that's got the society affiliation? Your journal of record from the society. The answer is yes, 81% of the time. Okay, next slide. And I see some questions coming up, so we're going to get to those. The search for trust. AI. This is just a kind of like a comment of the moment, but AI generated articles, 54% of physicians don't yet trust those. Okay. However, if the articles have been then passed through the human level of peer review content, then we're up to 79%. So there's a path forward there. So I don't think it's anything to be afraid of as a health system, but to know what kind of AI generated articles are out there. Okay, slide. Okay, then credibility. Okay, so we talked. So I mentioned, I was tooting the horn of Wolters Kluwer, but we cannot be in the space that we're in without the credibility and maintaining that. So peer-reviewed content is highly credible. 71% of physicians, not quite as many as NPs. The specialty websites, maybe non-society affiliated, way down, much below that. And then general websites, people don't know who's behind the website is often the question that is the barrier to credibility. So next slide. Okay, so gonna whip through some best practices and then to the questions. So the placement of messages can drive a next action. So I think that's a best practice. Anybody that's considering, should I do any advertising to drive referral or recruitment, using a third-party source, there's a lot of options out there. If you saw a sponsored message, what next action would be most likely for you to take? Okay, so the highest is with the online journal medical site, and then a member site, and then a resource center is also quite high. Resource center is often supported or sponsored by medical society, and we've done those for pharma and new drug launches, and certainly for healthcare systems. And then on the right, the stacked bars, the blue action is visit the sponsor's website. So the sponsor, I think the way the question was phrased could have meant, pharma sponsor, or it could have been like a healthcare system. So online medical journal website is about 20% there. Okay, the next slide. 2 more really interesting things. Leverage content with credibility is with high credibility. So that's a best practice. So this could be, we've seen people do like an ad in an e-newsletter where they would pick up like a latest finding, like a latest best practice article, and then embed on top of that something about the drug or the healthcare system, and then make some message around that. And that really drives up credibility because it's coming from, a trusted source. But the types of messaging, and it's the peer-reviewed research again, excuse me, comes out on top. Clinical data citations, do very, very well, and that's something that I know a lot of healthcare systems consider doing. Calling out society association, anything like that really lends to the credibility. And then the things that maybe aren't as high, you can study the slide later on, and we're happy to give guidance on that. So next slide to, this is really important. And, it's different for every kind of healthcare system, but, we say, as much as you can in your surveys and communications with your physicians, every system has hundreds of physicians. They're super active in their societies. They're going to their society events and their annual conferences. They're going to be publishing articles. You should know when those happen and when those occurred. 32% of physicians, in any specialty, even GPs, are publishing in the last 2 to 3 years, which is quite high. And in PAs and NPs emerging. Okay, so final slide. Okay, you can't see this, but I love the slide on the upper left. So one of our leading publications, and this is the leading publication in neurology from the American Academy of Neurology that Wolters Kluwer has published for many, many years. One of the most recent clinical guidelines that was published on ischemic stroke was co-authored by an HonorHealth physician. And Kevin and Veronica, I talked a little bit about this, but maybe there's some way that article can somehow be used to promote, to bring physicians in from other systems or get the cross referral. So I know a lot of folks are doing that. And I also really love when I see a great news site or news releases. So there's a couple great news releases that were on the HonorHealth website. And I saw that the research that was actually linked to. So it wasn't a direct link, but there's a lot going on in that space. So maybe if there's a news item, somebody's made a discovery, and you can pair that with a journal article. So there's a lot that you can do. A lot of creativity. Feel free to look at the slides and pursue us for questions, but I hope it gives some directional ideas for folks. So thanks for letting me take a couple extra minutes, Susan.
No, that was great though. And your last piece that you just shared, I mean, one of the things that, and Veronica, you could probably speak to this as well. One of the things we talk about so much from a liaison perspective when they're engaging with referring physicians in the field, that clinical piece is vital. And so just how you can use some of this content for how you use it in the field, I think is also extremely valuable. So not only how it can be used in terms of how physicians access it, but how we help them engage in it. I think that's really, really good. So thank you all. This was really good. I'm going to go straight to questions. And I was not able to see the chat through this because when you put your screen up, that chat disappears. So I'm going to pull it up. But I do have a couple of questions that have come up in the question box. So let's start with those, and then we'll try to hit some of these that were in the chat as well. So somebody asked a question about how do you target NPI and digital advertising? What's the channels that allow this? So I'm guessing maybe we'll start with Kevin, Veronica, and Ben, if you've got some insights on that too.
Sure.
I'll let HonorHealth kind of chime in there.
Sure.
Kevin?
I can take a stab at that one. So I'll do my best to answer the question succinctly without endorsing any particular vendor. But I would say just make sure that you have your goal established. So is it to schedule a meeting with a physician leader of a medical group? Is it to drive net new referrals at scale, or is it to put your brand and the innovations that are happening at your organization in front of a wide reach audience? So there are going to be different platforms and vendors and groups out there and agencies that are going to be able to offer specific goals. So I would just say up front to anyone that's asked in the chat about specific groups that have helped us succeed, just make sure that they can show you the results and make sure that you have your goals outlined beforehand. And I trust you're going to be able to do that. So in terms of targeting NPI and matching that with IP address, I don't claim to be the expert there. We work directly with a media buyer who's able to connect those two. So what that looks like on the consumer side or on the doctor side is that they're scrolling on a website that they would otherwise already be on. And when there's an advertisement, you're able to have your organization advertised on there. So again, I'm not doing the media buying. I'm not doing the NPI IP matching, but that can be done by
Yeah. So, thank you, Kevin. That was a really good perspective from the health system side. So as a publisher, we do have an NPI program. An advertiser would come to us either with a list match. They might say, hey, here's 500 NPI numbers. Can you target these NPI numbers across your network, either through email or through journals? So it's absolutely something that can be layered into an ad program. Or we can do ad programs that would surface NPI numbers, and we could just provide that back to the client. This is all strongly protected data. We don't never pass back like personally identifiable data, but NPI numbers are all part of the public record, and there's ways to do it. And there's types of programs that make more sense than others to leverage that, but a lot can be done. But oftentimes, you'd have to have a vendor that you're working with, and then kind of pair up with WK.
Oh, that's very helpful. I got another one for you though, Ben. This one is also from Brittany. Can you give examples of specialty specific tactics outside of the specialty medical association and journals?
Yes, hi Brittany. There's a lot that can be done, and every program, every effort, I think is unique to itself, and I think it takes a meeting of minds to figure out what the tactics are. Our team doesn't do what we'd call like transactional media or transactional selling, where somebody would come and say, I want to put an ad in this journal and kind of be done with it. It's much more effective, I think, for you to come with a set of goals and ideas, and then to figure out what any number of publishing partners could do for that. One thing that we really like would be like knowledge centers and resource centers. Like a lot of these things can be built as a hub that would be then under like a trusted environment umbrella, and then drive traffic to that. But that's right for certain programs and not for others. We did a program where it drove hiring for certain communities and levels of physicians, and got just incredible results, and we're able to surface content from throughout and build a custom program like that. So that's one option other than the normal. Brittany, thank you.
Thank you, Ben. I got one that came from registration. And this one might be, Kevin, Veronica, for you, but maybe even for you too, Ben. So I'll let you all chime in here. What do you do if your doctors don't check email?
I'll take a first stab at this one. So one thing that we've done for across all communications is a nudge. A nudge to non-openers. If somebody doesn't open it the first time, respectfully, five days later, you're going to get the exact same message just in case you missed it. And what that does, right? So it could very well be that they don't open the second email as well. But what that does is it shrinks the audience. So if you're trying to communicate a message, it makes the delivering that message to the non-openers much more manageable.
I would also like to add is verify that you have the correct email. Because in our situation, anytime that anyone gets medical staff privileges, they're given an HonorHealth email, and that seems to be like the top priority contact line for that physician. And then turns out they never open up that email. So make sure that you are using the right email address that they will open. That's number one.
Well, and just like Kevin shared, I mean, so much of this is it coming from a trusted, like, like if it's coming from HonorHealth, like, so we have to build that, so that they have that need to want to open it. So that's a really good one. I think that was all the time we have left. I'm going to, and thank you both, all three of you, because just really good insights, very different, but kind of covered a good spectrum. So I'm going to turn it back over to Daniel. I think you have a couple closing remarks.
Yep. Thank you, Susan. I'm sure the audience joins me in thanking you, Veronica, Kevin, and Ben for that terrific discussion. And thank you to everyone in our audience for taking the time to join us today. Please note that if you've asked a question that we weren't able to get to, we'll do our best to get a response to you. We'll also be sending out a link to the webinar recording, so watch out for that within the next few days. That concludes today's program. We hope to see you at future forum webinars. And mark your calendar for the Healthcare Marketing Physician Strategy Summit, May 4th to 6th, 2026 in Salt Lake City. Please visit the forum website, healthcarestrategy.com, to learn more. Finally, be sure to give us your feedback by completing the evaluation survey as you exit the webinar. Thank you and have a great day.